mynews.studio.
A single worm, 1 year, and a legacy of suffering. Can the world finally kill Guinea worm, or will dogs keep it alive?
Today is February 21st, 2026. The number is 10. That's how many Guinea worm cases were recorded last year, down from 15 in 2024, and a staggering 3.5 million annually back in 1986. It's almost eradicated.
But the last 10 cases may be the toughest. Guinea worm, or dracunculiasis, is a parasite that infects humans who drink water contaminated with its larvae. After about a year, a meter-long worm painfully emerges from the skin. There's no vaccine, no drug, and no immunity. Just prevention.
The Carter Center has led the campaign since the 1980s. It started when Jimmy Carter saw entire villages in Africa devastated. He rallied ministries of health, NGOs, and local volunteers. The core tactics: filtering water, treating ponds with larvicide, and isolating cases.
It worked. Guinea worm is now limited to 6 countries: Angola, Cameroon, Chad, Ethiopia, Mali, and South Sudan. But the last mile is complicated. Do you know what's driving the stall now?
It's not just humans anymore. In 2024, there were 664 animal infections, mostly dogs and some cats. In 2025, that number was 550. These animals drink contaminated water, get infected, and then contaminate more water. They act as reservoirs, keeping the disease alive even as human cases drop.
Right, and that's why the focus shifted to a One Health approach. Now, health teams aren't just tracking people, they're watching animals too. In Chad and Cameroon, infected dogs and cats are isolated, high-risk villages are treated with larvicides, and copod-free water is provided.
Why is it so hard to scale? Is it resources, logistics, or something else?
All of the above. Remote villages mean tough terrain. Surveillance needs to be nearly perfect. Every country has to show 3 years of 0 cases for WHO certification.
Civil unrest in Mali, South Sudan, and Sudan makes it dangerous for health workers. Over 2,400 villages are hard to reach. Remember when Carter threatened to call it Ghana worm after Ghana's outbreak? Sometimes political pressure is the only way to refocus national efforts.
In these conflict zones, outside teams can't get in, so local volunteers are trained for detection and reporting. That's adaptation on the ground. But even with these changes, it's a slog. Complacency is a risk. Countries can backslide if vigilance drops.
What can global health learn here? This campaign shows that low-tech solutions like pipe filters and community volunteers can outpace expensive interventions. But collaboration is key. Ministries, Carter Center, CDC, WHO, UNICEF, all pulling together.
And Carter's legacy is more than Guinea worm. 100 million cases averted, almost 10 million years of suffering prevented. That's diplomacy, grassroots power, and partnership in action.
Could this model work for other neglected tropical diseases? The combination of community engagement, animal surveillance, and international partnerships seems adaptable, but it needs patience and persistence.
So, as we look toward the 2030 WHO goal, 0 human and animal cases, Guinea worm is proof that teamwork and persistence can beat even ancient scourges. But only if we keep the pressure on, the last mile.
That was Guinea worm's last stand. 10 cases, millions saved, but hurdles remain. Thank you for listening. This episode was powered by the mynews.studio. Try now for free.